Hello, everyone. Today, we're going to take a deep dive into a very serious and timely topic. News coming out of India has been making waves on social media recently. Have you ever heard of the Nipah virus? If not, I strongly recommend watching this video until the end, because even the World Health Organization has listed this virus among its priority threats. What's happening in India? Let's start with the current situation. Since December, 2 confirmed Nipah virus cases have been detected in India's West Bengal state. These cases are particularly concerning because both occurred in healthcare workers. In other words, the virus was transmitted in a hospital setting. This gives us an important clue about how easily the virus could spread under certain conditions. India's Ministry of Health acted immediately. A total of 196 people who had contact with these 2 cases were tested, and fortunately, all results came back negative. However, the situation is being closely monitored, and all necessary public health measures are in place. So far, no cases have been reported outside of India, but neighboring countries are on high alert. Which brings us to the main question: is this virus really that dangerous? What is the Nipah virus, and where does it come from? The Nipah virus isn't actually new. It was first identified in 1998 in Malaysia. The virus gets its name from the village of Nipah, where it was first discovered. That outbreak began in pig farms and later spread to neighboring Singapore. The scale of that first outbreak was truly alarming. More than 100 people lost their lives, and to stop the spread of the virus, 1 million pigs had to be culled. Just imagine that, 1 million animals. This also caused massive economic losses for farmers. So where does the virus come from? The main reservoir is fruit bats. These bats carry the virus and can transmit it to intermediate hosts like pigs, and from there to humans. Initial transmission often happens like this. Fruit bats bite or contaminate fruit with their saliva, and when people consume these fruits without washing them properly, the virus is transmitted. Past outbreaks. After the 1998 Malaysia outbreak, the virus continued to appear, especially in Bangladesh. Since 2001, more than 100 people in Bangladesh have died from the Nipah virus, making it the most affected country in recent years. In India, 2 regions stand out. West Bengal experienced outbreaks in 2001 and 2007. In the south, the state of Kerala has become a hotspot in recent years. In 2018, Kerala reported 19 cases, 17 of which resulted in death. These numbers alone show how high the fatality rate is. In 2023, 2 out of 6 cases were fatal. What are the symptoms? Now, let's move on to one of the most important parts. What happens if you contract this virus, and how long does it take? The incubation period, the time between infection and the appearance of symptoms, is typically between 4 and 14 days. Some sources suggest it can extend up to 45 days, but the generally accepted range is 4 to 14 days. Initial symptoms are fairly common and flu-like: fever, headache, muscle pain, fatigue, vomiting, and sore throat. At first, these don't seem particularly alarming. Unfortunately, things can get much worse. In some patients, these symptoms are followed by drowsiness, altered consciousness, and pneumonia. Shortness of breath may develop. In severe cases, the situation becomes critical. Brain inflammation, known as encephalitis, can occur. Patients may experience seizures and even fall into a coma. And here's the most frightening part. The fatality rate ranges from 40 to 75%. Let me repeat that, 40 to 75%. For comparison, the overall fatality rate of COVID-19 was around 1%. Even survivors are not necessarily in the clear. Some people who recover develop long-term neurological problems or experience relapsing symptoms. In other words, even if you survive, the virus can leave permanent damage. Is there a treatment or a vaccine? Now we come to perhaps the most troubling part. As of today, there is no approved treatment or vaccine for the Nipah virus. Yes, you heard that right, there is no definitive cure. This explains why the World Health Organization takes this virus so seriously. WHO has included Nipah virus among its top priority diseases, alongside pathogens like COVID-19 and Zika, due to its high outbreak potential. How does the virus spread? Understanding transmission is crucial. The Nipah virus primarily spreads from animals to humans. Fruit bats and pigs are the main sources, but the most dangerous aspect is this: it can also spread from person to person. There is, however, an important distinction. Unlike COVID-19, Nipah is not an airborne virus. It does not remain suspended in the air when someone coughs. Transmission requires close contact. The virus spreads mainly through saliva and bodily fluids. Shared objects, contaminated food, or close contact while caring for a patient can all facilitate transmission. How can we protect ourselves? So, how can we protect ourselves from this virus? Here are some practical steps. First, do not consume unwashed fruit. Be especially cautious with fruits that bats may have access to. Always wash fruits thoroughly with clean water. Second, be mindful of foods that bats can reach. Avoid consuming food that has been left uncovered. Third, avoid close contact with infected individuals. If you are caring for a patient, always use appropriate protective equipment. Fourth, pay close attention to hygiene rules, especially in hospital settings. Remember, the West Bengal cases involved healthcare workers, highlighting how critical infection control is. Reactions from neighboring countries. Following the cases in India, neighboring countries have gone on alert, and understandably so. Thailand took action last Sunday. 3 international airports in Bangkok and Phuket that receive flights from West Bengal have begun screening passengers. Travelers are required to submit health declarations. In addition, Thailand's Department of National Parks, Wildlife and Plant Conservation has implemented stricter inspections at natural tourist sites. Thai officials stated that they are well prepared for a potential outbreak, but are taking precautions nonetheless. Nepal has also taken measures, screening travelers at Kathmandu Airport and at land border crossings with India. In East Asia, health authorities in Taiwan have proposed classifying Nipah virus as a Category 5 disease. In Taiwan's system, Category 5 refers to emerging or rare infections that pose significant public health risks and require immediate reporting and special control measures. In other words, it's a very serious classification. Comparison with COVID-19. Now let's address the question many of you are probably asking. Is the Nipah virus as dangerous as COVID-19? Let's compare. Mode of transmission. COVID-19 spread through the air. When someone coughed or sneezed, the virus could remain airborne and infect others. That's why so many of us caught it. I personally had it several times. Nipah, on the other hand, does not spread through the air and requires close contact, making it less contagious in that sense. Fatality rate. This is where the real difference lies. COVID-19 had an overall fatality rate of about 1%. Age and chronic conditions increased the risk, but most people recovered. Nipah virus, however, has a fatality rate of 40 to 75%. Age or pre-existing conditions don't significantly change that risk. It's extremely deadly for everyone. Treatment and vaccines. Vaccines were developed for COVID-19, and treatment protocols were established. For Nipah, there is currently no approved treatment or vaccine, making it much more dangerous pandemic candidate. Similarities. Both viruses originated in animals, and bats are believed to be the primary reservoir for both. This highlights how critical it is to carefully manage human-animal interactions. In short, COVID-19 affected many people, but most survived. Nipah has affected far fewer people, but a large proportion of those infected have died. Is there a pandemic risk? Now to the big question. Could this virus cause the next pandemic? Experts already consider Nipah virus a potential future pandemic threat. However, it's still too early to say for sure. At present, the pandemic risk is considered moderate, possibly even lower. That said, several factors are concerning. Climate change. As bats migrate due to climate change, the virus could spread to new regions. Changes in habitats increase the geographical reach of the virus. Mutation risk. If the virus mutates and becomes airborne, the situation would be far more serious. This hasn't happened yet, but it's not impossible. High fatality rate. The virus's lethality is extremely high. A large-scale outbreak could have devastating consequences. Lack of treatment. The absence of vaccines and effective treatments would make controlling an outbreak very difficult. Conclusion and recommendations. So, what's the bottom line? At this point, there's no reason to panic. The cases in India appear to be under control, and there is no evidence of widespread transmission. However, being informed about this virus is absolutely important. There's a reason the World Health Organization has placed it on its priority list. My recommendations to you: always wash fruits thoroughly, just to be safe. Avoid contact with bats and other wild animals. Follow health authority guidance regarding travelers from affected regions. Stay informed, but don't panic unnecessarily. Remember, knowledge is power. Being informed about viruses like this helps protect both you and your loved ones. See you in the next video. Stay healthy, take care of yourselves.